Hi viewers, welcome back. In today's video, we are going to discuss about multiple pregnancy. Okay, it is a very interesting topic, multiple pregnancy. So what is multiple pregnancy? When there is more than one fetus, then you term it as multiple pregnancy. Okay, so maybe it is a twin pregnancy, that is when it is 2 you say as twin pregnancy. When there are 3 fetus you say triplets. When there are 4 fetus then you say quadruples, and goes like that. Okay, so now we will describe or discuss in detail about multiple pregnancies. Okay, so when we come to multiple pregnancies, we have two varieties of multiple pregnancy. One is biovular twin pregnancies and uniovular twin pregnancies. So when you have twins, that is when you have two babies, so you have either of the choice, that is the biovular and uniovular twins. Biovular twins, so what does the word means? It is bi, two ova are getting fused or getting fertilized, you say biovular twins. And then we come to the uniovular twins, where only one ovum is going to get fertilized and going on, that is like the division is going to take place when the cell multiplication begins, that is around like 4th to 8th week. By that time the cell division takes place. Okay, so now what happens in biovular pregnancy? So when there is a biovular twin pregnancy, usually you have two placenta, that is like bi, so two pregnancies, like two babies are separate. So what happens, you have two placenta, two amnions and two chorions, and most of the time the sex of the babies also may differ. Okay, but in uniovular twins, what happens, you will have a single placenta supplying to both the fetus, then two amnion will be present for both the fetus separately, and one chorion is present, and most of the time the sex of the fetus is going to be the same, that is most of the time it is like uniovular twins or of same sex babies. Okay, so this is with your uniovular and biovular twin pregnancy. So when we come to the prevalence, so who are at utmost risk of getting twin pregnancies? Actually twin pregnancy is something like which is very interesting. You have two babies, the growing up phase, everything is easy, but there are a lot of complications also during twin pregnancies. Okay, so prevalence, who are having the highest risk? So it is when we come to the race, so usually Negroes, so they are having the highest incidence of twin pregnancies, and Mongolians, they have the lowest incidence of twin pregnancies. Okay, so and when we come to the hereditary factors, there are families which run with twin pregnancies or quadruples or triplets, like so there are like families which are running with twin pregnancies. So in that condition, when the maternal factors, that is like if the condition is prevalent from the fetal, that is from the maternal side, from the mother side, the features are going to be more dominant. So most probably she may also have a twin pregnancy. And then when we come to the age and parity, so when you come to the age of the mother, age above 30 to 35 years, so conception during this particular time, they have lot of risk to have twin pregnancies or multiple pregnancies. And when we come to the parity, again the parity, when the number of pregnancy increases, the chances of having multiple pregnancy also increases. So usually a fifth pregnancies and above that, there are more chances of having multiple pregnancies. Next we come to the iatrogenic factors, that is like hospital induced, that is like when you go in for ovulation induction, at that time there is more risk of having multiple pregnancy. And then we have a condition called as fetal papillaceous. So this is a abnormal condition or a high risk condition which is very predominantly present with uniovular twins. So what is this condition? When you have a twin pregnancies, so any one of the fetus dies inside the uterus of the mother. So the death of that fetus is not going to affect the other baby. Okay, so any one of the twin is dead, and what happens? It gets compressed between the fetal membranes and the uterine wall. So it goes and attaches with the uterine walls. So sometimes it is ruled out when you are doing an ultrasonography. Sometimes you can identify only during the labor, that is like when the placenta is coming out, at that time only you will be able to see that there is a flattened structure, that is the old twin which has already expired. So that is the condition. And sometimes it becomes an unknown area also, like it becomes like very capricious and you are unable to rule out. Okay, so this is also present in some cases. Okay, so these are the areas you have to remember when they are asking with the prevalence of multiple pregnancies. And then when we come to the lie and presentations during multiple pregnancies. So multiple pregnancy, you have two fetus. See, you know the fetal uterus. So it is qualified to have a single fetus. Okay, so the capacity is like that. So now in case if it is a twin pregnancy, the uterus gets adjusted according to the need. So what happens? So most of the time what happens is both, that is like cephalic presentation for both. The baby is longitudinally placed, both the fetal heads lying down in the pelvic region. Sometimes it is the first fetus having a cephalic presentation and the second fetus having a breech presentation, or otherwise sometimes it is ulta. So what happens? The first fetus is having a breech presentation and the second fetus will have a cephalic presentation. There are some conditions in which the first fetus is having a cephalic presentation and the second fetus is having a transverse presentation. So anything can be present. So you cannot go in for a description. By the time when the labor is going to begin, at that time only you will be able to identify what is the exact position that is the baby placed in with. Okay, so now when we come to the diagnosis of a multiple pregnancy, so how do you rule out multiple pregnancies? So nowadays, like, you have lot of technologies, that is like in the beginning only you start with your ultrasonography. So that time only you will be able to rule out in case if there is a 2 gestational sac present. Okay, so otherwise, so what are the general things like which indicates there may be a multiple pregnancy? So first thing is with your history collection. So when the mother is telling an history, so first time when she is coming to the hospital, so you start collecting the history of the mother. So when the mother is telling the history, she usually comments that she is having hyperemesis. Hyperemesis is vomiting more than the normal. Okay, so normal vomiting and nausea is present during pregnancy, but hyperemesis is more than the normal. So when there is an increased amount of hormones, when there is an increased amount of progesterone, so the woman will experience lot of vomiting. So that is hyperemesis. And when there are 2 babies, that is when there is a twin pregnancy or a triplet, so what happens? The hormone level is going to be more in the sense abnormally more than the normal, so which is going to induce vomiting for the mother. So that is increased amount of vomiting will be the first complaint of the mother, and tiredness will be present. And sometimes what happens, the mother usually gives, like when you start collecting the symptoms of the mother, they may tell, okay, so they will have some abnormal histories. So histories in the sense, like you can also have a family history of twin pregnancy, and sometimes like people who are Negroids, like where we have already seen the prevalence where Negroes have highest prevalence. So at that time also you can identify. When we come to the symptoms of multiple pregnancy, usually the mother complains of increased vomiting, that is already we have discussed, and the mother may tell increased tiredness. okay, because like again the body has to work for 2 fetus. So what happens, the mother becomes more tired and she may complain of palpitation because there is an increased cardiac workload. The cardiac volume is going to increase, like when there is a twin pregnancy, already there is an increased cardiac workload during pregnancy. Now during twin pregnancy what happens, it becomes doubled. So what happens, the mother may feel breathlessness and palpitations. Sometimes the mother will say that she is having an abnormal weight gain, she is having an abnormal heaviness that is present, the abnormal enlargement of the abdomen. All these are symptoms of multiple pregnancy. And next, when we come, we have to go in for general examination. So when you are going to rule out, okay, when you are going to diagnose whether it is a multiple pregnancy, so at that time what examinations you will be able to identify. So one is abnormal increase in weight of the mother, okay. So you can't imagine like when the mother is increasing weight in the first trimester or in the second trimester, when there is a sudden increase in the weight, you have to suspect multiple pregnancy. And sometimes you can see there is preeclampsia in the mother, where there is an increased blood pressure, proteinuria may be present, there is an increased edema, varicosity, hemorrhoids. All these things can be present during the pregnancy, which you have to have a query that the mother may have a multiple pregnancy. And then when we come to the abdominal examination, as always, abdominal examination we have to go in for infection, inspection, palpation and auscultation with your internal examination. So inspection, so when you are going to see the abdomen of the mother, you are able to see the abdomen is enlarged or it is going to be big than the normal gestational age what the mother is having, okay. So it doesn't correspond with the gestational age of the mother. And then when we come to the palpation area, you will be able to see the height of the uterus is above the required age, and the abdominal girth is going to be more, and the abdomen is going to be more globular, and it is like more of barrel shaped, you can say, okay. So it becomes, the abdominal girth is going to become more than the expected gestational age. And then you can come to the next area of palpation, where when you identify, where when you palpate, you will be able to feel lot of fetal parts. So you will be able to feel many hands are present, many legs are present, 2 heads are present, many foots are present, okay. So it shows that there are multiple chances for multiple pregnancies, okay. So that is with the abdominal palpations. When coming to the auscultation, you will be able to hear 2 heart sounds, 2 predominant heart sounds, maybe one at the top of the uterine region, that is near the fundal region. You will be able to feel one heart sound, and one heart sound near the like your pelvic pole, or one on the right side or one on the left side. So you will be able to see or feel, you can hear the fetal sounds very predominantly in 2 areas. So that is again an indication of twin pregnancy. Then we come to an internal examination. So when you go for a PV, you will be able to identify one fetal head in the pelvic region and one fetal head in the abdominal region. So again it is in indicating multiple pregnancy. So that is with your abdominal examination. Then finally coming to the investigations where you confirm the multiple pregnancy. First is your ultrasonography, where you will be able to see 2 gestational sac, and like if you have doubts, you can go in for a radiography to rule out 2 spines, that is like fetal spines. You will be able to identify 2 fetal spines. And like when you go in for a blood investigation, you will be seeing the maternal serum chorionic gonadotropin hormone level is high, and the estradiol level is going to be high, and fetal alpha fetoprotein level is going to be high. All these are going to get elevated because of multiple pregnancies. Then we come to the differential diagnosis. What is the meaning of differential diagnosis? It is the differentiation between the multiple pregnancy and the other abnormal condition. So now you want to confirm whether it is multiple pregnancy or some other condition. What are the some other condition which is resembling multiple pregnancy? One, you have hydramnios, so that is like polyhydramnios. Already we have discussed polyhydramnia in our previous videos. If you have doubts, you can go and see that video. And then we have big baby when the mother is a diabetic mother, at that time the baby also becomes diabetic, that is the baby will put on weight and you will have big baby. At that time also the abdominal enlargement is going to be there, the baby size is going to be big and you are able to see the abdominal girth is going to be more, everything is going to be more. So at that time. And then fibroid. So when there is a pregnancy with a fibroid, so when you are palpating, what you will be able to identify? You are able to identify the fetal head, you are able to feel the fibroid, and everything will be present, like which is going to make you confused whether this is a multiple pregnancy or some other condition. So you have to, again you have to confirm. Then ascites. So when there is some other medical condition which is causing ascites for the mother, so at that time also you will be having this increased abdominal girth and all those things. So these are the differential diagnosis areas where you will confirm that the mother is not having these diagnosis, it is only multiple pregnancy. You have to diagnose that condition. Okay, so then we have the complications. So complications in the sense, like we have already, I said like complications are two, you have maternal complication and fetal complications. So maternal complication, again we divide maternal complications into antenatal, intranatal and postnatal complications. So antenatal complications, so what are that? See, already we said the mother is going to have a terrific period. So the physiological changes during pregnancy, it is going to get multiplied. So it is going to get doubled and tripled. So when there are going to be a multiple pregnancy. So now what happens? Definitely the mother is going to have severe nausea and vomiting. So already I said mother will experience hyperemesis gravidarum and then anemia. See, when there is a normal conception only, there will be an increased hemodilution which is going to cause anemia. Your physiological anemia is going to happen during the antenatal period. Similarly, now the hemodilution is going to be more. So what happens? So definitely there will be anemia for the mother, and then already we discussed there will be preeclampsia for the mother. So there will be an increased blood pressure level, there will be edema, so generalized edema, facial edema, proteinuria, all these symptoms may be present with the mother. And then hydramnia. So when there are two fetus, the amount of amniotic fluid secreted is also going to be high. So the mother may present with polyhydramnias, and then there may be a chance for antepartum hemorrhage, that is the mother may have a placental previa, because like two fetus are there, there is no adequate space for the placenta to get safe handled. So what happens? It goes and gets implanted in the lower region which it considers it is like more safe. So what happens? It goes and lies down in the lower uterine segment, which can cause placental previa, or sometimes when there is two fetus pulling up the placenta, there may be abruption also taking place. So anything can happen. Then the next area of malpresentation, already we have discussed during lies and presentation, there are more chances for malpresentations in the mother. So anything vertex presentation, transverse presentation, that is according to the comfortability of the baby goes and lies down in the uterus. So anything, any presentation can happen. And then comes the preterm labor. So in the beginning I said you, the uterus is a cavity which can hold only this much capacity. Okay, so now in case if it is a twin pregnancy, what happens? The placenta is going to be big, or to placenta, amniotic fluid is going to be big, the baby is going to have increased weight. So all these things will be present which the uterus cannot bear. It's more than its capacity. So what happens? Like by 40 weeks it is going to deliver the first baby. So what happens? So now the weight will be sufficient to terminate the pregnancy before that only. So what happens? There can be a preterm labor, and then mechanical distress is already During the signs and symptoms, we have said the mother may experience respiratory difficulties, palpitations, varicosities, edema. All these things are distresses which can complicate the pregnancy period. And then coming to the intranatal complications, we have preterm premature rupture of membranes, because like already I said, the cavity is going to become full and there may be a preterm labor. So preterm rupture of membranes may happen. And then operative interference. So we said like one head may come out or one fetus will come out, the second fetus will get blocked. So at that time, high head of the second fetus, so you must use the forceps or otherwise a cesarean section. So anything can be done. Then we have bleeding. So already one delivery has taken place. So one first fetus, most of the time there will not be any complication. The first delivery will take place smoothly, whereas the second delivery, that is like the delivery of the second fetus, there may be a risk of bleeding, where there may not be an adequate uterine contraction. Atonicity of the uterus can happen. So at that time also there may be bleeding. And then postpartum hemorrhage. So again the uterus is like more stimulated and at that time there may be a postpartum hemorrhage. Okay. So then we have postnatal complications, we have subinvolution. So involution is the reverting back of the uterus to the pre-pregnant state. Subinvolution is when the involution is not taking place completely. At that time subinvolution takes place because the uterus has extended and expanded more than its normal. So now what is happening? There will be subinvolution. It will take a long time for the mother to revert back to the pre-pregnant state. Then comes infection, because like maybe there are bits of membranes or the parts which is left inside the uterus that can cause infection for the mother. So sepsis can happen. And then we have failing lactation, or like maybe the lactation is not sufficient for both the babies. Okay, so anything can happen. So lactational problems also may be present. Okay, so then we come to the fetal complications. So first fetal complication is miscarriage. So miscarriage is inadequate perfusion to the uterus. When the mother is weak, when the uterine perfusion is not adequate, at that time there may be a chance for miscarriage or abortion. And then we have premature baby. So already we have discussed there may be a preterm delivery, there may be a premature rupture of membrane. So at that time there may be a preterm baby also. And then we have intrauterine growth retardation. When there is inadequate nutrition for the baby, there is intrauterine growth retardation, and intrauterine death also may be the next step. When the nutritional deficiency is high, there is an intrauterine death also present. Then you have anomalies. Okay, so the uterus, if it is not getting expanded or like it is not helping both the fetus to survive, so at that time there may be fetal anomalies present. And then there may be asphyxia and stillbirth. So because like two fetus has to travel the birth canal, what happens? Like sometimes there may be a delayed birth, there may be an obstructed labor. In that condition, what can happen? There may be asphyxia and stillbirths. Okay, so these are the fetal complications. So twin to twin transfusion syndrome is a very important syndrome in which the recipient, there will be a donor twin and a recipient twin. So just imagine the donor twin. So one twin will be a donor which is very great hearted. So what he does, he gives more blood to the other twin. Maybe it is a placental vascular abnormality or something which is present inside the uterus. There is an abnormal connection between the fetus. So what is happening is one fetus, that is like one twin, is going to donate more blood to the other twin. So the recipient twin, what happens? The recipient twin will have polycythemia. The baby will become big. There will be hypertension. There will be hyperolemia. Everything will be present to the donor twin. What happens to the recipient? The recipient doesn't get anything. The recipient becomes very small, anemic, hypolimic, hypotensive, and finally both are under risk. So here what can happen? Sometimes both the twins will die, or otherwise one of the twin will die. Maybe the donor will die because of malnourishment and anemia. So what happens? The baby will die, the donor will die. Sometimes the recipient, what happens? He is receiving lot of blood, so he is unable to tolerate that workload, that heavy cardiac workload he cannot tolerate. So what happens? He also expires. So anything can happen in twin to twin syndrome, which is a very interesting area and an important viva question also. Okay, so this is part like a part of twin pregnancy or multiple pregnancy we have discussed. So in the next video, let us discuss about the management of multiple pregnancy. Hope you understood the class. In case if you have any doubts, kindly go to the comment box and write it as your comments. So let me explain you. Okay, take care, bye.